on today, and the reason that I'm here is I have a big passion about all the complex things that interplay and really impact our patients with chronic venous insufficiency. So when we look at this global kind of definition, it's a chronic condition that has incompetent valves, it affects the venous system of the lower legs, and it causes venous hypertension. And so what do? You get pain, swelling, edema, skin changes, and ulceration. Well, I think it's a little bit more complicated than that, and I think we all know that, right, when we look at our patients. So I was blessed to be able to be part of this consensus document about the Gecko, but the thing that excited me the most about it was the fact that we were actually taking a step back and looking at some of the other important factors that actually truthfully are more important to our patients than the wounds on their feet. We're able to look at...
Center, yeah, there. Right. Should be good, she said.
You guys can't hear me apparently. I thought it was really loud. So we're able to look at this complex interplay, and this is so important to me as a physical therapist because this is how I view the world. I break things down into the impairments, and then I see how can I help those impairments. And I'm really excited that we're finally taking a step back and addressing these impairments without necessarily worrying so much about healing the wound, because I think sometimes we get really stuck on that. The other thing that I'm really excited about is the fact that now we're looking at using technologies that have long been a part of my arsenal to treat some of these things, and we're starting to bring them to the forefront and utilize them a little bit more.
So we're going to do a little bit of a tag team here because we didn't know how else to do this. And that mic is turned really loud. It's much louder than yesterday. So as we go into this, the treat the cause piece is really, really important because we continue today to see patients who are getting multiple wonderful dressings used without the due diligence of treating the cause. And treating the cause is not a new idea. It was first documented in the literature in 1545. It became part of the wound bed paradigm in about 2000. This is an update from 2015. Identify, treat the cause. Last year, when Wounds Canada did the update for their best practice recommendations, it was still there in their top left-hand corner. But sometimes the more things change, the more they stay the same. So for me, using this Gecko device, oh, see, we're sideways again. Does it look okay up there? I can't tell. No, I think it's sideways. It's something with the video. Anyway, come to our booth to see how it will work. It's fine in the video, but it plays sideways. There should be no sensation of pain when you put the Gecko device on. It may feel odd because there'll be a tapping sensation, but your leg certainly won't distort and look like mine does in that video. The foot and the leg should move slightly upwards and outwards, and when you stand, the common perineal nerve actually moves away from the fibular head so that it doesn't pose a risk of falls, which is really important with our elderly population. And because of the nerve becoming tolerant of the stimulation, many people find that they really forget that they have it on after a while. There are no contraindications in the instructions for use, but as with any medical device, it's important that you read the instructions because there are important safety precautions in there and warnings. So again, it's information that's there to make sure that we're matching the product to the right patient in a safe way. So when the CWC did the consensus document last year, I was really intrigued. I like algorithms too, and this work was by Dee. She didn't mention that when she showed it in the first slide. But I loved it because for me, having taught about venous leg ulcers at Western, about the hard to heal ulcers, it really shows you that a venous leg ulcer has a lot of complexity with it, and it depends on the degree of disease, but Dee's algorithm really showed that. And I started to work on an annotated bibliography about the Gecko device earlier this year because I needed to get my head around what do we actually know so far about the device, what studies have been done, what research has been done. So as I was putting together the annotated bibliography, which you can get on our website, I started circling in the consensus document, and I thought, Yes, we know something about this. Yes, we know something about that. So what Dee and I are going to do in the next half hour is run very quickly through. Dee's going to do the normal. What does chronic venous insufficiency do to the body? And I'm going to tell you what we know to date about the Gecko device.
Oh, this is the most,
I forgot about this. Yeah,
part.
this is the exciting one. So I circled all the, thank you, I forgot. But what we're learning is that it does also seem to improve adherence to compression. And the other piece is it gives many patients a feeling of hope. So I think those are really important. So we're going to talk about those as well. And sorry for this being a little bit unsmooth, not smooth to get started, so that you got the brochure, you got a sample of the device at the door, but in there you'll see that we have a table that sort of does a synopsis of what Dee's going to talk about, and then on the right-hand side we give the literature to date, what we know to date.
So, when we think about chronic venous insufficiency, this is some old data, but I just love this because it really speaks to how important that calf muscle pump is. So yes, we know that incompetent valves have a huge part to play. You know, those people who've had, DVTs, pregnancies, they're people that stand on their feet, so their valves are shot, their veins are shot, they maybe have a family history of it. But this really speaks to how important that calf muscle pump is and how important all these factors are, and it's just amazing how all these things kind of interplay together. And I know that you guys, when you think back to some of your patients that you have, you can start to see some of these features pull out, and I think it's just really important that we notice how complex this is. But this data from Gross in 1993, he did a little survey of some patients, and he found that 3/4 of his patients had this valve dysfunction that we all know about, but 60% of those people also had evidence of calf muscle pump failure, and 1/4 of the overall people had no obvious findings of valve problems. But 95% of those people had some sort of a neuromuscular disorder that hampered their lower legs. So just really highlighting how important that calf muscle pump is. And then now we even have some newer data that also supports that. 55% of patients with chronic venous insufficiency also have that calf muscle pump failure. And we know that exercise is very powerful in combating that. And it's proper gait training, those proper exercises are very, very powerful. So let's take a little deeper look as to what that calf muscle pump is all about. And I mean, we know it is really like a heart, and that's probably the best analogy that you can use when you do educate your patients. So the pump consists of that muscle with the fascia around it and the veins within that same compartment. And so when you contract your muscle, or you point your toes, or you do that push off when you walk, and that's the other key piece that I think sometimes we forget, is that proper gait is very important for that proper calf muscle function. So that muscle contracts, it squeezes the blood out, and when that muscle relaxes, the blood kind of flows back in again. And then you also have a pistoning effect when you do the opposite movement. So when you dorsiflex your foot or bring your toes up, you actually also are able to force blood out as well with that pistoning action. And then the other thing that we sometimes forget about is your foot pump. So that's where the weight bearing becomes so important, because as you step on your foot, the fascia also tightens, and it also has the same effect of helping to push some of that blood out. But just like everything in our body, it relies very heavily on things working together, right? So if you just keep squeezing that muscle and you have valves that don't work properly, what happens is the blood actually can also be squeezed back down again. So it's really important that your veins close during that muscle relaxation to prevent that backflow. And then when they're open, you can maintain that one-way flow. So if you have an impaired muscle pump, you're going to have this backflow across those valves at rest. So it's very important to have the two working together.
Good. One more. There we go. There's your
there's circles. I forgot about the circles.
Those circles. Good. Okay. So we talked about whether we would leave those circles in or not. We should have taken them out. So what happens with the Gecko? When you activate those lower leg and calf muscle, I said it. That's terrible. The lower leg and foot muscle pumps, It's really the anterior and lateral muscles that you're doing. It's not the calf. You're not getting a flexion and dorsiflexion. However, because there is a concurrent activation of the lateral gastrocnemius and an increased activation of the medial gastrocnemius at the back, you do, oh, look at that, it did that all on its own. There's no active contraction of the gastrocnemius, but you do get an extension. And that's in response to the contraction of the tibialis anterior muscle at the front. So while it's not making the calf muscle pump, it's not actually stimulating it, you're getting the benefit of it. And then by that happening, and we'll see if we can now, how do you get this to work with this? I hope that the video will play when you don't have a cursor. Can you put the cursor on the video on that, please?
There we go.
Good, okay. So I'll just talk that through so you can watch what it's happening. So because it does a near isometric compression of the venous valve system, they feel that it may actually evacuate more blood than just by contracting the gastrocnemius alone. And that's where the talk about the calf muscle pump comes in, because it's giving you the benefit, or it's acting like a calf muscle pump. Still not the same degree, but it is somewhat, and it's promoting venous return by increasing that intramuscular pressure. And they felt at this point in time, which was 2014, that it may be effective for reducing venous stasis and edema. And then again, you can see on the left, and hopefully the one on the right will activate there in a minute. There we go. So on the left, you can see all that gray. So those are red blood cells. And it's called the sludging index. And it means that even though the heart is contracting there's still a lot of venous blood that's sitting and not being ejected forward. And then on the right, you can see when the Gecko device is activated, most of that gray has dissipated. It's being pushed forward and back to the heart. And it is a statistically significant difference with the activation of the device. That's you.
That's me. So the other thing that is very impactful to chronic venous insufficiency that we don't necessarily always think about is the fact that a lot of these people have decreased range of motion and they have impaired mobility. And it's kind of really a perfect storm, right? Like we see it all the time. It's almost like this big tsunami of being inactive because their legs hurt and they're weepy and they are edematous, so they're less active and it makes it worse, and it just goes on and on and on. And a lot of things that impact this are things that I think we as clinicians need to address. So not necessarily focusing on healing the wound, but focusing on all these things that are important to the patient. So pain can have a huge impact on your range of motion and your mobility. That actual shape of their leg, that thickness, that woody fibrosis is huge because you can't move that tissue, right? The edema itself. Some people end up having a fixed ankle joint. You know, people who've had fractures, or if they've got neuromuscular diseases. Decreased muscle strength and activation is huge, and I skipped that one on purpose because this is something that I think we need to really think about as we're putting people in compression, because compression is 100% what we need to be doing with these people, but we also need to realize, as with every treatment, there is a consequence. So when you put people in compression, it actually decreases their range of motion. So by putting them in compression, you're actually impairing their calf muscle pump, which is the very thing that they need to make their leg healthier and to work better. So we need to really take that into consideration. It's very important. Well, I'm not very good at this, am I?
That's okay. We're doing it. That's good. So what do we know so far about how Gecko impacts people who already have that decreased range of motion, mobility, or activation? What we're hearing from patients, and it's hard to get the words from them, because they'll say, my legs feel different, or I'm walking better, or their legs feel stronger. So it's hard to quantify things like that. But what we do know is that patients are showing an increased range of motion, and this man who had pretty severe chronic venous lymphedema in both legs, within 2 weeks of wearing the Gecko devices bilaterally, had better better range of motion of his ankles. He could flex and dorsiflex his feet. And he actually told the nurse, I can wiggle my toes, which he truly could not remember having been able to do in the past for a very, very long period of time. And then this is a more recent patient. This is just in September. We're doing an evaluation in Waterloo, Wellington, and I know we have people over in this corner of the room from there. But so this was the day we started this man, and again, he's a chronic venous leg ulcer. It's his lateral malleolus, so a little unusual presentation. but he does have some lymphedema secondary to his venous disease. And when I saw him again on October 5th, so that was really only about 10 days of wearing the Gecko device, I was in the clinic to see a new patient that day, which was why I was there, but he came in at the same time, and I was sitting there, and all of a sudden I noticed that when the nurse took his high compression bandaging off, he was just sitting there flexing and flexing and flexing his ankle. And I looked at him and I said, so is that different than when when we started before the device? And he said, yeah, it is. And I said, can you wiggle your toes? And he could, and the look on his face of surprise was pretty neat. And I said to him, so are you going to the bathroom a little bit more? Yeah, he said, yes, I am. So something is happening. As that edema is being pushed out, this is way too soon to talk about what's happening with his fibrosis or anything. But certainly, if you have that improved mobility, range of motion, I think these are probably parts of what we're seeing when they say, I'm walking better.
And so, on that note, we do just want to touch a little bit on how we talk about walking and how we compare effects of walking. So it's really hard to do venous pressure measurements during walking because you're moving and things fall out, and it's just really hard. So kind of what the gold standard is in the literature is doing 10 dorsiflexions and tiptoe movements in 20 seconds in a supine position. And then you put the cuff around the thigh, and this is really kind of how we measure that. And I think Connie's going to talk a little bit about some literature around that.
So normally what they do are 10 flexions and dorsiflexions, and they say that that's the equivalent of what you would get when you walk. So when they did the first research back in 2010, they did a similar measure with the Gecko device, and they had patients do 10 dorsiflexions with their heels still on the ground. And then when they measured that, you can see the yellow line there. That's the approximate current, and the frequency for the Gecko device is 1 hertz or 1 impulse per second. The Gecko devices that we're using for wound care and for edema management are actually 54 MAs, so just a wee bit higher. But even with this amount, they were getting 60% of the benefit of walking, is what they say. So 60% of what you wouldn't see with the dorsiflexions are what they achieved with the Gecko device. So this is where, just doing the math, we sort of said, well, 60%, let's say 50%. So what we say to our patients, if you will wear this device for 6 hours a day, you're going to get a lot of the benefit as if you had been able to go for a 3-hour walk, because that's a rough math for there. The neat thing for patients who have a lot of comorbidities, which many of these people do, is that it doesn't impact their blood pressure. So it doesn't tax their circulatory system while it's giving that benefit. So it doesn't change their blood pressure. It doesn't increase their heart rate. In fact, there's actually been some work done in London at London Health Sciences that showed that it actually improved the coronary circulation by 15%. So interesting. So while it's giving that benefit of walking, it's not going to tax the system.
So edema is kind of that other impairment that we really think about when we are thinking about people with chronic venous insufficiency. And it really does begin around that kind of perimalleolar region, and it kind of comes up the leg. And we've all seen it, right? Like over time, that just gets harder and thicker and more fibrotic and more horrible looking, more inflamed looking over time. And there's a lot of kind of cellular things that actually happen, and you get changes to that fibrinolytic system that make that leg look like that. And unfortunately, over time, what happens is it ends up being venous lymphedema. And so it can be very debilitating for people because it feeds into that inactivity cycle. So all the things that we can do to help that are so much more beneficial.
So what we know with the Gecko device is that it is making a difference in edema. So here are just a couple of examples. For acute edema reduction, in the UK, up in Yorkshire, and when I Googled the hospital, I thought, I wonder if this is a coincidence. So they were looking at ankle fractures where they needed to stay in hospital waiting for the edema to go down before they could go to the operating room to have an open reduction. And what they decided to do was to put them into the Gecko device along with their back slab cast and wrap, but then to just track and see what difference it made in terms of wait time once the edema was down, that they could take them to the operating room. So when I looked to see where is that in the Yorkshire Dales, you can see that there are 3 huge parks there, the Lake District, the Yorkshire Dales, and I think the Moors National Park. So I'm not sure if it's a coincidence when you think of all the hikers and walkers that there would be in those areas that they're having more ankle fractures. I'm not sure. But in any case, they've been able to shave 2 days pre-op off of their hospital stay for these patients. So what this hospital is actually going to do for the next year is make that their standard of care, and then they're going to do more analysis to look at other benefits such as wound healing, surgical site infection, all those sorts of things. So that's encouraging, and that's for acute edema. And then for chronic edema, again, this is a recent patient, also in Waterloo, Wellington, and this is one where this man actually doesn't have an open wound, and so our evaluation for the chronic patients was to be people with open wounds. And the nurse in the clinic brought this patient idea forward and said, you know what, he's been coming in for over a year to have his high compression bandages changed weekly because he can't be independent, and because his edema is so severe, he can't wear stockings. So without having seen the patient, but just hearing, I asked her a few questions about, you know, are you wrapping above the knee? Are you wrapping his toes? What are his toes like? I said, you know, it sounds to me like he needs to have a workup. He's probably eligible for assistive devices. He probably needs to have an ET consult. I don't know if he's had one in the past, but maybe his toes need wrapped, maybe he needs wrapped above the knees. And those of you who are caring for people with lymphedema are probably shaking your heads. So it turned out I was sick. I wasn't able to go down to see him on the first visit, but the ET nurse was there, and she called and said, you know what, he's been scratching and he can't put the device on in the normal position. I'm going to have to put it above his knee. And I said, okay, and I walked her through how to do that. He could feel a little bit of sensation there, but you couldn't see a twitch. He couldn't feel any sensation going down his calf. You couldn't see a twitch on the skin. You couldn't see any foot movement, even with the setting at the highest. And I don't know if you can read his measurements there, but in 13 days, and she didn't change any of his compression. She said, you know what, he needs a workup, we need to get ultrasounds, and I'm not going to do that today. I'm not going to change his compression today. Let's just see if the Gecko device can help push some of this edema down so that we can get him into the proper wraps, in a faster time frame. So in the first 13 days, his measurement above his knee on that left leg went down by 10 centimeters. His mid-calf didn't change a whole lot. Now, I've been back to see him at the end, or I guess it was 2 weeks ago, and the mid-calf had started to go down, but the ankle had already gone down and the mid-foot as well. And again, I said to him, are you going to the bathroom more? And he said yes. More often and more volume. So he's diuresing it out. It's moving it forward. And that's pretty chronic edema with this man.
So this is actually where I get super excited. This is where I think we as clinicians, myself included, maybe don't do such a great job, but it's such an impactful thing. I think it's probably, when you spend time talking to your patients, it's probably the thing that they will think of as most impactful in their life, because it limits them from participating, it makes them miserable, it really it's hard, right? Like, it makes life hard, it interrupts sleep. So just to give you an idea, we were doing a bit better of a job. This is actually some Canadian data, and in 2003, the mean pain severity score in a group of patients was less than 3 out of 10. And of the individuals who had pain, there were people who were getting analgesia, and 75% of those people were saying it was effective. But now you fast forward to 2011, we asked another big group of patients about pain pain, and 90% of them said they had pain on admission, but only 25 to 30% were having any analgesia. So to me, that's a bit startling, because this is something that is so impactful and something that we have a big arsenal of tools to do something about, whether it's medical or physical things that we can do, and we're not maybe addressing it like we could. And so what we're kind of seeing is that even a lot of the patients within our Gecko, Gecko case studies, is that those people also have pain and they can't tolerate their compression because of it. So this is an impairment that needs to be something that we focus on.
So what we know so far with the Gecko device is that patients are reporting a reduction in their pain. So doing evaluations, you're dependent on people documenting what the patient has said at baseline, what the past history has been, and then what the impact is. So incidental in several of our case series of our own and other people, Brooks Irvins, which is in the UK, they're finding that there is a reduction in pain. What they feel theoretically from the CWC consensus document last year is that it helps to release those endogenous opiates and hormones that are within the body, and then it activates the own pain relief mechanism. So if you have a reduction in your pain, it helps to improve your mobility. Your patients who say, I don't need anything for pain, and then you say to them, okay, well, I'm going to turn you over and do this and this and this, and they say, don't touch me, I have too much pain when I move. It's the same sort of thing. So helping to reduce their pain makes them more mobile. And certainly what we've found in these evaluations is that it's very important that you have a goal in sight. So just putting them into the Gecko device doesn't ensure that they're going to go into higher compression, because you have to have somebody driving the boat or the car or the truck or whatever you want to call it. You have to have somebody in charge that knows that that's a goal and then works with the patient so that as soon as that pain scale starts to go down, you can gradually increase their compression therapy and get them into what we would consider to be therapeutic compression for their level of venous or arterial disease. So whatever's safe, because you can have people with normal ABPIs who can't tolerate more than a single layer of tubular compression, and we all have those patients.
So this is another area that I actually get really excited about as well, because I think this is something that we don't necessarily recognize as much when we're working with our patients. And I think that this piece is kind of maybe the cornerstone. I know we kind of have it over on the side of our algorithm there, but it's kind of the cornerstone, because when you think about our other patients that we see with neuropathy, it impacts hugely their mobility, it impacts their level of pain, it impacts the health of their skin. These are all the things that we see with our patients with chronic venous insufficiency, right? So I think that this is something that we need to keep in the back of our mind, that because these people have these poor legs that are filled with chronic edema all the time, all their little nerves that are trying to go down into their legs are being basically starved. They get degeneration, they get collagen replacement in those areas. They don't get the blood flow that they need. So they're basically nerves that don't work properly. And sometimes when you take that edema away, that gradually starts to come back. So that's something that we need to think about. And obviously, as with some of our other patients with neuropathy, neuropathic pain can be debilitating, right? And we know that, and it should be something that we need to keep in the back of our mind as well.
So we know we're not doing a very good job in tracking neuropathy. I did a pain tool several years ago to help nurses communicate better with physicians or primary care about what the pain was like and what was the impact on them in terms of their ability to eat, to sleep, to do the things they wanted to do. I think we're really good at doing the pain scale, a 0 out of 10 or 0 to 10, but we don't always ask about the stinging, throbbing, burning, all of those neuropathic symptoms. So we know as we do more evaluations, we need to do a better job. And there are validated tools that help you to address the neuropathic symptoms. But what we have heard from our patients, and I realize this is very low level, this is the lowest level, these are case studies, but you listen to your patients, and they'll say, I'm sleeping better. You know, my legs used to wake me up at night. It would be like an electric shock going off, and my legs would just jerk and wake me up. And that's not happening anymore since I started using the Gecko. A patient who had to stop the Gecko with one of our evaluations because he developed a rash under that early hydrogel. And he had told the nurses, you know what, my legs are so much more comfortable that whatever it was for him, stinging, burning, tingling, had stopped. He went off the device while his skin cleared up. The symptoms came back. He went back on the device, the symptoms reduced again. So there is something happening. And then another patient who described to her nurses one day they were washing her leg and putting lotion on before they rewrapped it. And she said, you know what, I can feel you touching my leg again. And she said, I couldn't feel that before. So her normal sensation was coming back, as well as a reduction of the symptoms. So we'll do a better job going forward in better capturing that.
Yeah, and actually just to add to that, I mean, the Gecko device itself hasn't really investigated that, but there are some studies on devices with similar parameters to the Gecko that actually show positive changes in neuropathy. Using scales like you're talking about, having improvements in those scales, and then actually you can actually measure C fiber activation, and there was a study done by Ogren in 2009, and they showed increased C fiber activation using a similar parameter device. So there is something to that. So I think it warrants a lot more investigation for sure. And where we do have some good data, and where they have some good data, is looking at arterial flow. And as we know, a lot of our patients with chronic venous insufficiency are inactive, they're unhealthy, they have a lot of comorbidities, and so they typically end up with at least some form of peripheral artery disease, coronary artery disease, that kind of thing. So 15 to 30% of people with venous disease also have mixed disease, and that's from 2011. So it's always something that we need to keep in the back of our mind. Not to mention the fact that their legs are so swollen that it's like trying to shove blood down into something that has no room to take more blood. So I mean, it's a big problem.
So these videos just show really what happens. So we know from the literature, and again, could you activate, yes, thank you, get rid of that. If you could activate that for me, thank you. So you can see on the left, this is before the device. So this is just normally systole, diastole. The upper is the artery, the bottom is the vein. And what the Gecko device does is it increases the volume and the velocity of the flow. So you can see just the difference, faster flow, bigger colors there. And then when there have been two vascular surgeons in the UK who have done quite a bit of the research in doing hemodynamic testing. And we know that for patients with intermittent claudication, it has increased, not statistically significant, but it has increased. And as Dee said, you know, if they have so much impairment in their flow that they can no longer walk because of pain, which is what intermittent claudication does to people, a 30% increase is probably going to make a big difference. And those are measured at the femoral level. It's not down in the lower leg, so you are getting a whole leg benefit, and even the microcirculation to the dorsum of the foot. And when they looked at it also with a group with either chronic venous insufficiency or PVD, also about a 32% increase in the arterial flow. And then this one I love. This was one that Dr. Harding showed last year at the CWC, but again, it just shows, and this was his patient who came into the clinic, the one patient who came in on the day that he had the speckle spectroscopy device, which measures the flux, so the changes in circulation to the skin. So the area is over that infected leg ulcer, and you can see in the middle that's just normal heart systole, diastole, so there's a slight increase as the heart's beating, and then as the Gecko device is activated, you get a huge increase in the color there.
So cool.
Isn't it cool? Yeah, it is. It's pretty visual. All right.
Okay. Again, I think this just really speaks to that perfect tsunami of interplay of factors that really impair our people and give them all these problems of chronic venous insufficiency. You know, you can have those valve malfunctions, the DVTs, the impaired calf muscle pump, and inactivity. And again, it's just that big cycle, right? And we all see it. And then that translates into this venous hypertension that causes the dermal changes. And then I just love this little picture on the side because it just really reinforces in my mind how important activity actually is. Because if you look, you've got the venous pressure. So when we're standing, it's very high, right? But once you start moving and activating that calf muscle pump with a proper heel-toe gait, that pressure actually drops, and it drops a lot. And then you can also see there the different impairments that people have. So if they have superficial insufficiency, deep insufficiency, or venous obstruction, how much that pressure increases. And then again, you go back to standing. So that's what I always tell people, you know, standing, sitting are very bad. Walking and moving are actually really good, right? Because now we're actually having an impact, but it needs to be proper. It can't just be, because how many of our patients walk like this? Right? With their little walkers in front of them, so they're getting no activation. You need to actually move that ankle. So just really encouraging people to do that. But there's some people that can't do that, right? So that's where we need to be innovative in what we're using, right?
So what we know to date is a study in Manchester in the UK where they did measure the ambulatory venous hypertension in people with healthy veins. So we know that it helped in those situations. Now they're doing the same study for people who have active venous ulcers, and they're doing additional tests as well. So perhaps when we come back next year, we'll have better hard data to show what is actually happening with the chronic venous insufficiency. But it's certainly encouraging to date that something is happening there. I think I'll do this one, yes. So on compression therapy, it is light blue. We're color-coded, and we just have to remember that we are. So we don't know. People will say, well, does this mean that they don't need to have compression therapy? No, we don't know that at this point in time. We believe that it's an adjunct to best practices and that it certainly helps to improve that adherence to compression therapy. And again, we'll be doing a lot more in our evaluations. We'll be doing more intentional tracking to see when is that point in time when patients may actually start. Is that within a week? Is it within 2 weeks? At what point could you expect that they would start to tolerate more compression? Here.
And just reiterating the fact that, and we know this, right, because we're with these people every day, how their lives are impacted. It's a huge toll on them. They can't work, they can't do the things they enjoy, they're sitting in chairs with puddles around them, they are embarrassed, and it's huge. And we just need to kind of bring that always back to that, I think.
So we know that one study in the UK, it has not been published yet, it's been in 2 posters, but they did look at quality of life. It was very ambitious. They used 7 different quality of life tools at baseline, and again at end of treatment, so they used the Gecko device for 6 weeks, and 30 of those patients had chronic venous insufficiency. And then again 2 weeks post-treatment. So we know that there was improvement with their scales with the Gecko device for those with the venous pathology. Again, more research is needed as we get ready to go into randomized controlled trials in conjunction with the UK and Europe. These are things that we'll be doing a better job of trying to capture, but we certainly hear from patients' stories. Our experience with the chronic non-healing venous population, which is where we started, certainly hope people say, I know it's working, I can feel it's working. And as we shared last year, and in these 2 papers that will be in the International Wound Journal in the December issue, we've been able to accelerate healing for these chronic non-healing ulcers, really to a rate 7% in the ear St. Clair H&HB one and over 9% per week reduction in surface area. And if you think about those markers of when a wound is healing as it should be, so a venous leg ulcer that's healed 28% at 30 days is one that should go on to heal within 12 to 24 weeks. That's a normal healing trajectory. So do the math, 4 weeks divided into 28 gives you 7, and we were able to achieve that with what had been chronic non-healing ulcers before that, and I think that's pretty significant. Well, we know it is. It's statistically significant. And again, Waterloo Wellington, where we've been able to evaluate the device with patients with new ulcers. So as soon as they came on service, the nurses were to determine, does this look like it would be a good candidate? Would the patient be appropriate for the Gecko device? So far, we've only had 8 that have healed. It took about almost 4 weeks by the time they were assessed, had their lower leg assessment, got the doctor's orders, and then got the devices in. But it's pretty remarkable. So those patients have healed 15 wounds in 8 patients, and the average reduction surface area per week is 50%. Per week reduction in surface area. The picture in the middle is a lady with trauma but had venous disease, and she came in, we taught her how to use it. She was heading to the US for a holiday. She came back, she had healed in 3.5 weeks, and this was a pretty big skin defect. And she said, if I didn't have that device, I'd still be walking around with that big hole in my leg. And I was pretty surprised to see that degree of complete closure in 3.5 weeks. So on average, if you either go by patient or by the wound, it's still under 3 weeks to heal. And pre-Gecko, they were not doing that well at all. Some of them were, some of them weren't. There was a range. But we're going to be doing more evaluations like this. We want to continue to build the evidence, to build the story. And then in turn, this might provide a foundation for another RCT in the next year.
And just kind of to wrap things up, I just think it's awesome that we're bringing light to how complex this is. It's very important that we realize that there's other impairments that we need to address, and if we address those impairments, are we going to have wound healing? Well, there's no data to tell us that, but I think it speaks to the fact that you're improving the patient's quality of life, you're enabling them to participate in their life, you're enabling them to be a little bit healthier, and I think that that's really key. And I mean, there is avenues for other wound types as well, right? Because there's a lot of times these people have these unhealthy legs, right? Yep. So I mean, it's just keeping that kind of wide open.
And then this is early evidence. We can't pretend any other way. It is early evidence, but this is what we know, what we've reviewed. And I just think in closing, I'm not going to read those because it's just a repeat of everything we've just said. But we do have a slide to take away. You're going to get ready for lunch, and we do have this, we're just building a learning management system that will be on our website. I'm hoping for, well, by Christmas at the very latest, but December 1st would be even better. And this module will be on there, although it'll be all me talking and not the wonderful Dee sharing it with me. But I hope it's been helpful. I hope it shows you the progress that we've made and the better understanding that we've had of what the device is doing in terms of helping our patients. Thank you.